Dr. Chiu, let's talk about good-looking cosmetic dentistry, especially like in the front. I'm sure there are several options, and one of them, which you mentioned, would be, if a few teeth are a little bit crooked, but basically they're good-looking, their color is fine, and they're not damaged, that maybe doing an Invisalign treatment would be really, really a good thing. The other one would be maybe to put some veneers or lumineers on it. Now, I would like you to, shade some light on those a little bit, and especially just a tiny bit explain us the small difference between lumineers and veneers, because to us laymen, this really looks the same, and yet you guys are using a different terminology, and we get a little confused over here at that end. So tell us a little bit, and tell us any other thing which I might not have mentioned, which are good and important to achieve a good-looking front mouth here. After all, $1 million smile is just that. It's $1 million smile.
Sure. There are options for veneers versus lumineers. The veneers are traditional veneers. We usually need to shave down part of the tooth and add a porcelain to replace the missing tooth structure. Versus the veneers, versus the lumineers, we have the option now without having to shave any tooth structure down. It's a lot more conservative and it's reversible. If we can basically just take it out and there's no damaged tooth structure on it. But and the lumineers, by the way, usually we don't have to give shots, which is pretty painless procedure. But depends on the situation, on each patient. We make a decision to see what fits the most. I mean, lumineers is great option if you do qualify.
What are some of those qualifications? What should not be present in order to be able not to get lumineers? In order to get lumineers, sorry.
Sure. Well, if you have a lot of gaps and your teeth are not too much forward, those are the very good very good candidates to have lumineers done. So because what happens if you have gaps, we can add the porcelain on the outside, the lumineers on the outside, and close the gaps very easily without having to sacrifice any healthy tooth structure.
Okay, so if teeth are very, very close together, then maybe a lumineer is not so good because you need the space to go in it.
Yes, somewhat is true, but if there's a lot of crowding, if there's a lot of teeth are crowded and forward, then you have to shave down some of the teeth to make it look nicer, to make it look straight. So lumineers in that sense would not be a lot of benefits versus the traditional veneer.
Okay. What about if you, let's say, have one tooth chipped because you went to a bar and the guy didn't like the way you look, and he kind of punched you one and bang, there's that one tooth chipped. Would a lumineer be good there, or would that lumineer, because it kind of like is after all gets put on the tooth, would it make that tooth look a little more bulky and big, kind of like a rock in the sand or so?
Yes, it depends on the situation where that tooth is. If it is more protruded, which I mean is more towards the outside of the arch, then yes, it will look a little more bulky. But if it is more inside, then it's fine. It will blend in.
Meaning, it's just because you have that one tooth missing or, something wrong with it. You don't necessarily need 4, 6 or so lumineers or veneers in order to make it all look good. And even technology is so that one tooth can be adjusted so that it fits the other ones quite nicely. Or not?
Yes.
You're the one who give me what it is what it is.
Mm-hmm. Yes.
Yes, what?
I'm sorry. What was the question again?
So can you fix just one tooth? If one tooth got chipped for whatever reason, can you fix it and adjust it to the rest of the teeth, be it with lumineers or be it with veneers, so that you don't have to, so to say, pay for 4 or 6 lumineers in order to make the mouth look good again? Can you do just one and make it look good?
Yes. We definitely can, fix that single tooth to make it match, make it look nice and, blend in the rest of the dentitions.
Yeah. And what about the people, let's just say especially adults maybe, and maybe even teenagers, maybe there's no difference between adults, but I've heard about adults, they have these 2, 3 teeth which are kind of somehow crooked in front, not too much, but nevertheless crooked. And the teeth are in perfect shape. They're in perfectly good-looking teeth, let's just assume. They're just a little crooked, not quite, in it the way they should be. Would you, and again, there's probably a fine, I'm not asking you to make a diagnose here, but would in many cases, in that case, would it be wiser to not grind the tooth down, not put a lumineer on it even, but to actually use Invisalign, half a year, straighten them out, and have the teeth, the natural teeth, untouched, put back in place, beautifully straight?
Yes, definitely that would be my recommendation. Whenever we can get away, making the teeth look nice and get away without having to sacrifice healthy teeth, that's the best approach in treating the problem. So Invisalign is a great option in correcting those problems. Within a few months, you can straighten out those teeth and keep a healthy smile.
Because I have heard, and tell me how much of that is true and how often it might be true. It's like any tooth you take and you start grinding on it, you are damaging the enamel on top of it, and you're basically invading the tooth, and you basically could possibly give the tooth a shock. No different than when we kids were carving a tree, and our parents told us, don't do that, you might kill the tree, because basically it is a surgery, period. And many teeth survive it, but many teeth by doing so get some type of shock, and a few years later they need a root canal and they need all kinds of work because of it. Is that true?
Yes, it's a possible complication of any teeth that are healthy. We grind it down. It can cause enough trauma with the nerve, can potentially die in the future. That's always we always encourage to go the conservative route. If we don't have to grind the teeth down, that's the best option. You got to think also that any restoration, any fillings or any crowns or any veneers you have in your mouth, they eventually need to be replaced. And every time you replace it, you damage more of the tooth structure. So if there's a treatment that you can achieve without any grinding, any damage to the natural dentition, that's the best option.
So that would, let's just say, for a few crooked teeth in front, be maybe a lumineer, because they don't have to grind, you only glue things on it, or do Invisalign work. And if you have to, that the lumineer don't work and Invisalign don't work, or the person doesn't want to go through wearing 6 months and he wants to look good tomorrow, then that's when veneers come in, and it doesn't mean that all hell breaks loose. It just, you open the door a little bit to it to make the tooth dying a little faster. That's what it is, right?
Yes, correct.
Good. Well, wonderful. Does it really make a big difference when people change a few teeth in front and they're all of a sudden like nicer, and do they really then naturally smile more often where before they didn't smile and stuff like that? Is that really, have you really observed that?
Oh yeah, I see all the time. Actually, having nice looking teeth, you feel more self confident. You smile more. It actually puts you in a better mood. Just gives you a lot more self confidence.
And I really do personally, from a personal level, think that there's nothing more important than feeling, so to say, good about you. Even as a 58-year-old guy, it's just, that's what makes life go around. You get your job better done, period. As you said, if you're in a better mood, things are happening. You know how they say when it rains, it pours? Usually, to people who say that is, by the time it starts raining, they're in a bad mood. So and then more bad thing happens. And when you're in a good mood, more good thing happens. That's not by accident. So I do think it's a rather important part to be in a good mood. And if a healthy smile can do it, and as we said at the beginning, $1 million smile, take the Julia Robertson, take the Angelina or whatever her name is, or the Brad Pitt or the Tom Cruises. They have other abilities and other talents which are obviously what they are, but at the end we like their smiles. Isn't that what it is all about to a very high degree?
Yes, definitely, yeah.
Well, thanks a lot, Dr. Chiu. Very informative. Speak to you later.